We will show you the proper method of assessment for Glasgow Coma Scale. But first, let me define to you what is Glasgow Coma Scale. The Glasgow Coma Scale provides a practical method for assessment of impairment of consciousness level in response to defined stimuli. So in Glasgow Coma Scale, there are three kinds of assessment we should make. First is the eye opening. Second is the verbal response, and lastly, the motor response. So now, we will be showing you the first assessment, which is the assessment for eye opening.
When assessing a patient, check, observe, stimulate, and rate. The preliminary check is used to identify any factors that might interfere with your assessment. It is important to identify local factors such as a hearing impairment. They could cause a lack of capacity to respond. By following these preliminary checks, we can observe the patient to notice any spontaneous behavior in any of the three components of the scale: eyes, verbal, or motor. The patient is rated in each component by matching findings with the corresponding criterion. There are 4 criteria for eyes, 5 for verbal, and 6 for motor score. For each component, the top criterion is the normal response, while the lowest criteria is the no response. If the patient's eyes open spontaneously, spontaneous is recorded. If spontaneous is not demonstrated, a verbal stimulus is used by introducing yourself clearly. If the patient opens his eyes, to sound is recorded. If the patient does not open their eyes when you speak to them, physical stimulus is applied. Stimulation starts at low level by pressing on the nail tip and is applied with increased intensity. If the patient opens their eye, record to pressure. If they do not open their eye, record is none.
And the next assessment is for the verbal response.
To assess verbal response, ask the patient to tell you their name, where they are, and what month it is. If they answer correctly, record orientated. Able to speak in phrases or sentences, but is unable to give the correct answer, record confused. But if the patient talks insensibly, record inappropriate. If the patient moans and groans with no recognizable words, record incomprehensible. If the patient makes no sound at all, record no verbal response. Remember, speechlessness may result from factors such as presence of endotracheal tube. In these cases, record verbal not testable.
And lastly, the verbal response.
To assess motor component of Coma Scale, first, ask the patient to perform 2-step action, such as asking them to grasp your hand or opening the mouth and protruding the tongue. If the patient does this, record obeys command. If the patient does not obey commands, stimulus alone is inadequate. Apply pressure with increasing intensity until you observe the best response of the patient. If the patient moves your hand and attempts to move the stimulus away, record localizes. If the patient attempts to move the stimulus away like this, then record withdraws. If the posture of the arms of the patient are adducted and flexed with the wrist and fingers flexed in the chest, record decorticate. If the patient is in a posture that involves the arms and legs being held straight out, the toes being pointed downward, and the head and neck being arched backward, then record decerebrate. But if the patient does not respond to any stimulus, then record none. Findings should be documented clearly on the Coma Scale chart. So, to recap, check for factors that may interfere with your assessment. Observe the patient for spontaneous eye opening, speech, and movement. If necessary, then stimulate the patient, first verbally and then physically.